Nearly 40 million Americans are impacted by migraine, and depression is almost 2 times more prevalent in people with migraine than those without. Today we are joined by former co-host of The Doctors and my favorite person, Judy Ho, and chair of the American Migraine Foundation, Dr. Larry Newman, who's going to help us understand the connection between migraine and mental health. Welcome, Judy, and welcome, Doctor. How are you two?
Doing great.
Well, thank you.
Good. Doctor, I have to ask you, I want to start with you really quick here, and just help me out. This is one thing I want. We hear about migraine and migraines. Are they the same, or are we saying just migraine?
So the correct terminology that we use for the American Migraine Foundation and promote is migraine.
Perfect. That's why I want to make sure migraine. And let's talk about this, Doctor, because you guys have a survey how migraine and mental health connection here is affecting a lot of people.
We did. The American Migraine Foundation just did a fairly large survey of 1,100 people who live with migraine and more than 300 healthcare professionals. And the big take-home message was that migraine and mental health really significantly impacts each other. It's bidirectional. And because of that, it's really important for people with migraine to understand that if they improve their mental health, they're going to have better outcomes with their migraine and vice versa.
Okay. Judy, let's talk about some of your patients and how, they work and suffer from migraines and how that affects them.
Well, many of my patients suffer from migraines in addition to a mental health condition, but they're not really talking about it. I sort of have to drag it out of them, and oftentimes they'll say, yeah, I have these really debilitating headaches, and I'm trying to find out, are these headaches or are they beyond headaches, and it's migraine condition. And sometimes it takes them a while to get there because there's a feeling of stigma around migraine and how it influences mental health. In fact, the survey that Dr. Newman just referenced showed that more than 3 out of 4 patients worried about this stigma, this negative perception coming from other people, even their doctors. So they weren't talking to people about it. They weren't talking to their doctors about effective treatment options. I think there's fear that maybe they're exaggerating their symptoms, that they're even making it up, or that they were telling people they had migraine just to get out of responsibilities. And that's absolutely not true.
So, and Doctor, as G just said, the stigma. I mean, how do we remove the stigma around migraine?
Well, that's what we've been spending, the American Migraine Foundation has been spending more than a decade trying to do. And we do it 2 ways. We do it with education and we do it through conversation. So we spend a large amount of our time educating the public, the patient, their caregivers, their friends, their family, their colleagues, about what migraine is and what it isn't. More importantly, what it isn't. It's not just a bad headache. It's a legitimate medical condition that has a valid biological basis and strict criteria to make the diagnosis. And then we have conversations with the professionals to let them know that it's a real condition, how to diagnose it, and more importantly, how to treat it.
Doctor, you said something very important about treatment. What are some of the treatment options that you have to offer people out there?
So, one of the things that this big study, this big survey showed us was that pretty much all the healthcare practitioners and all the people living with migraine were pretty much aligned on what treatment needs to encompass. And by that I mean they wanted not a cookie cutter approach, but an individualized approach, looking at them, their headache, and their other conditions. And because of that, there's a wide range of options that we have. There's medical and non-medical. I'll talk a little bit about the medical. So the medical approaches include what are called acute therapies and preventive therapies. And acute therapy is something you take at the onset of the headache, the attack of migraine, to get rid of the headache, the nausea, the light and sound sensitivity, and take what could be a 3-day attack and hopefully get rid of it in an hour or 2. Preventive therapies are not taken just when you have the attack. It's taken every single day, or depending on the agent, once a month, the goal of which is to decrease future attacks by at least 50%.
And the non-medicational approaches are really about stress management, because stress impacts migraine condition as well as your mental health. So I teach techniques as basic as deep breathing. It sounds so basic, but it works so well. Teaching grounding techniques where you really get in touch with your physical space to stabilize yourself. Practical mindfulness, basically doing something that you do every day, but doing that single-mindedly without attention to anything else, without thinking about the past or the future. For me, it's about having coffee mindfully. And then finally, teaching ways to deal with negative thinking. And and particularly catastrophic thinking, because a lot of migraine sufferers will say, oh my gosh, I have no idea how long this episode is going to last, and maybe I'll never kick this condition, I just have to muscle my way through it. So teaching them more balanced thinking and then encouraging them, as Dr. Newman already said, to have conversations with their providers, providing that psychoeducation, all of that is going to be very helpful to help them to develop a comprehensive and unique treatment plan.
Yeah, wow, it's amazing. Doctor and Judy, we're so glad that you joined us. Can someone just tell us very quickly where they can find out more information?
Sure, if you want to find more information about the study, about migraine, about other headache conditions, where to find a specialist in your area, for instance, you can go to AmericanMigraineFoundation.org.
Thank you, too, for joining us.
Thanks for having us.